And to start with, I want you to memorize this, because when you understand this image, you understand a ton of cardiovascular physiology. The timing is everything when we're talking about the heart. And so using this, you can combine aspects of the EKG, the physical exam, and understand exactly what's going on in the cardiac cycle. So we will start with this important component, which is the P wave. Notice that with the P wave comes atrial contraction, and we can see that reflected here on the ventricular volume, because when the P wave happens, atrial contraction occurs, and that increases the volume in the left ventricle, right? So that really tops off the left ventricle. Then the beginning of the QRS complex, which corresponds with the first heart sound, or S1, begins this period of isovolumic contraction. Now, I want you to understand this because it becomes very important when we're talking about aortic stenosis. No blood is ejected from the heart during this period of isovolumic contraction. What's going on instead is that when the ventricle contracts, the mitral valve closes and the tricuspid valve on the right, and that allows the pressure to build up inside the heart until the pressure in the left ventricle overcomes the pressure in the aorta, right? Or the blood pressure. So this period of isovolumic contraction is just contraction of the heart and increasing the pressures until the aortic valve opens, right? So until we get to this point, there is no blood flow in the heart, or out of the heart, I should say. Then when the pressure is greater than the pressure in the aorta, now the aortic valve opens and ejection happens into the aorta. And then this period of isovolumic relaxation happens when the aortic valve closes until the mitral valve, that's the AV valve, the atrioventricular valve, which we don't talk about in clinical medicine, but the mitral valve opens and allows atrial filling. So notice there's two kinds of atrial filling. There's this passive atrial filling, ventricular filling, that happens when the pressure in the atria are greater than the pressure in the ventricles. And that passive filling is the first thing to happen. Notice if there's a huge volume of blood from heart failure, for instance, that passive ventricular filling can make a third heart sound. And that is exactly what happens when you have severe left ventricular failure and there's a huge volume of blood stuck in the atrium. As soon as the mitral valve opens, that blood falls into the ventricle and it makes a thud. And that thud is a third heart sound. So that's the first part of ventricular filling. The second part of ventricular filling happens with the P wave, right? So when the P wave happens, atrial contraction occurs, and that's when you really get the topping off of the ventricular volume. And remember that atrial contraction contributes somewhere in the neighborhood of 20% of the entire cardiac output. That's not insignificant. So that's the cardiac cycle. And you can refer back to this as we talk about things like aortic stenosis and mitral regurgitation and everything that the heart does, because this is really the basis for understanding all of it. The other basis for understanding what's going on in the heart is the pressure volume loop. So in this slide, it's important to remember that left ventricular pressure is on the y-axis and left ventricular volume is on the x-axis. Now, time is not represented here anywhere, right? So because we're moving from left to right, that does not mean anything about time. What is being reflected here, if we start at this point, is that the left ventricular volume increases as passive ventricular contraction happens as the atrium dumps blood into the ventricle. And that volume increases along this x-axis. But notice the pressure doesn't really change in the ventricle until atrial contraction happens. And that's where you get this little bump up of pressure and volume. Now, what happens at that point is ventricular contraction begins, and that's what closes the mitral valve. So the mitral valve now closes, and during ventricular contraction, that pressure increases dramatically. Remember, this is isovolumic contraction, which means that there's no blood moving. Notice that the volume is not falling here during this period of isovolumic contraction until the aortic valve opens. Now this is the period of ejection, and the pressure continues to go up, but the volume is decreasing until we get to this point where the volume has fallen off substantially and the pressure begins to fall. Now the aortic valve closes because the pressure in the aorta is higher than the pressure in the ventricle. And now the period of isovolumic relaxation begins. And during that time, there is a tremendous drop off in pressure inside the ventricle. And then when the mitral valve opens, that begins the period of filling again. So that's exactly what's going on in terms of pressure and volume in the ventricle during the cardiac cycle.